This is Healthcare's Missing Logic podcast, episode number 128. Today, our special guest is Dean Dr. Kevin Sneed. Dr. Sneed shares with us what he's learned and acted on during the COVID pandemic. Don't miss this episode.
Welcome back to Healthcare's Missing Logic podcast. This is the only podcast that shows you how to leverage polarity intelligence, an essential competency for healthcare leaders, and the missing logic in healthcare, so you can create healthy, healing organizations and become a thriving, resilient, and unstoppable healthcare leader.
We are your hosts, Tracy Christofferson and Michelle Trosett. We've been best friends and colleagues for over 30 years. And during that time, we coached healthcare leaders across North America around how to create healthy, healing organizations.
Today, we coach healthcare leaders and leadership teams to live thriving, resilient, and balanced lives, combat burnout, and create the best places to give and receive care.
This podcast is for the unsung hero of healthcare, the healthcare leader. We want you to know we see you and we'll be here for you each week. In this podcast, we're going to challenge healthcare's industry norms, flip limiting beliefs, and share proven strategies so you can be your best self at work and at home, live and lead intentionally, and experience well-being and joy.
We are glad you are here and look forward to sharing the journey with you. If you aren't totally convinced this podcast is for you, just listen to a few episodes and convince yourself. Greetings, this is Michelle from Healthcare's Missing Logic podcast.
Greetings, everybody. This is Tracy. Just trying a little something different.
Yeah.
Today, shake it up, Michelle. Shake it up.
Today we thought we'd start with greetings. And we mean it. We mean it. We greet you welcomely with our hearts. Welcome to the podcast.
We're grateful you're here listening.
Absolutely.
Yeah, all of that stuff.
Okay, we had another fabulous interview, people.
Surprise! Surprise!
Oh, we
did.
We did. We had an interview with a dear friend and interprofessional colleague, Dr. Kevin Sneed, and what a man.
Yeah, he has had some really, really thought-provoking experiences, I would say, during the pandemic.
Mm-hmm.
And what a leader! Wow.
Yes.
Like, he is really, really something.
Yeah.
Yeah. Really stepped up, has done a lot in his community and his university, and has a lot to be proud of.
Mm-hmm.
Yeah. It was really great to hear about.
Yeah. I just have a love for him. I met him many years ago, and I was so thrilled when he agreed to be in our podcast because, you know, we can kind of see what he's doing out there in the world to really make a difference. And it was fun hearing who his inspirations were as a leader. So you want to make sure to stay tuned and listen to that as well.
Mm-hmm. Yeah. And he's definitely a team guy.
Oh, yes.
All about the team, which
Kevin,
is great.
you can be on our team any day.
That's right. That's right.
So let me introduce you to Dr. Kevin B. Sneed, and then we will get on with the interview. He is a tenured professor and the founding dean of the University of South Florida, Taneja College of Pharmacy. He also serves as a senior associate vice president for USF Health. Dr. Sneed earned his Bachelor of Science degree in biology with a concentration in microbiology from the University of Central Florida. He received his Doctor of Pharmacy from Xavier University of Louisiana College of Pharmacy. He completed an ambulatory care pharmacy practice specialty residency at Bay Pines Veterans Administration Medical Center. He has received numerous clinical and leadership awards, and most recently was inducted as a Distinguished Fellow in the National Academies of Practice. He's received the Chauncey I. Cooper Medal from the National Pharmaceutical Association and the National Pharmaceutical Association Fellow from the National Pharmaceutical Association. Dr. Sneed serves on the board of several organizations and participates in many community endeavors, which you will hear more about in just a minute. So without further ado, here is our interview with Dr. Kevin Sneed. Well, welcome, Kevin, to Healthcare's Missing Logic podcast. Tracy and I are thrilled to have you as a guest today.
Well, I'm ecstatic to be here with you, and I couldn't think of a better opportunity, really, just to share some information during a pandemic and be with really someone that I've admired for a great deal of time. So thank you very much.
Oh, you're very welcome. We're looking forward to sharing what you've been up to, believe me.
Yeah.
Well, this is Michelle, and I remember like it was yesterday, the day that I met you in Tampa, Florida. We had a colleague and mutual friend, Kathy Veason, introduced us, and I don't think we stopped talking throughout our whole lunch together. And later, you were inducted as a fellow into the National Academies of Practice, and so we've had the opportunity to see you at several of the NAP forums through the years. And as a matter of fact, I don't know if you remember, Kevin, but Tracy and I, we did a breakout session on polarities in interprofessional education and collaborative practice. I remember you being part of that session. Do you remember that?
I remember it, and even prior to the invitation to be here with you all, probably a month ago, I was just reflecting back on that session, walking down the hallway by some of our laboratories. Honest to goodness.
Really?
Yes.
Wow. Well,
that's a very honest statement, by the way.
All right. Well, that's good. Well, we like to say, Michelle and I like to say we were doing interprofessional before interprofessional was cool. And so we were really curious to know kind of what sparked your passion for interprofessional care.
Well, to be perfectly honest, when I was an undergraduate and I was preparing to complete my studies, and initially I was going to go off and get a PhD in immunology. And then I kind of made a shift and I said, well, I'm going to go to pharmacy. When I talked to my advisor, he kept trying to shift me over to go to medical school. And I said, yeah, but I don't want to be a physician. But because of the training I had as an undergrad and even in pharmacy school, I just happened to fall into a very immersive environment where, there was nursing and physicians and pharmacists and respiratory therapists and a whole group of other people that really valued the input of everybody on that team. And I had an opportunity early in my professional school career to observe that, to live it, to experience it. And then when I became a faculty member, I again kind of fell directly into an environment where I'm working, as a PharmD with 10 other physicians, nurse practitioners, physician assistants, and again, very similar. Everybody has they crave the idea that they have an expert and that can contribute to patient care and do team-based care. And so it hasn't been difficult at all for me during my studies and then my professional life to really not only want to engage in interprofessional care, but to live it at the highest level possible.
That's wonderful.
Yeah, that is.
Not everybody gets that opportunity. So that was great.
Yeah, well, we need, and we're continuing to work very hard to try and create more of that type of opportunity moving forward. And I think we have plans that can unfold one day, but it won't happen because we woke up breathing air. We're going to have to continue to work hard at it and get more people on board.
Yeah.
Yeah. Well, I've been to your center, and it's very impressive, and I have no doubt that you'll continue to really advance interprofessional education and practice from your roots there in Tampa. Well, I'll tell you, Kevin, the reason we wanted you on our podcast today is we've been following you and we've been so impressed with your leadership and stepping up to make significant community contributions during the COVID pandemic. And it really is, we were talking, it's really about leadership to make a difference and to step out and stand out right now and really help people understand what they can do to help with the pandemic as well. And our first question for you today is just who inspired you to be a transformational leader yourself? Like, who was the person that inspired you the most?
Probably, to be perfectly honest, it was my dad. My parents, in general, I can focus on my dad, but really my parents. But I'm from Orlando. I grew up in Orange County, Florida, not California. And my parents were a second wave of individuals that came into the Orlando area and helped to desegregate the educational system in Orlando. And I never realized growing up how instrumental that was for them, and even the challenges that they had to go through. But one thing I learned from him was number one, it's never really about you. There's a bigger cause that we're all buying into. And then number two, just him investing time with me. And I often talk about the times that he and I sat down looking at Star Trek on the weekends. And I'm talking about the original Star Trek with a young William Shatner as Captain Kirk. And I just happen to believe that much of what I was looking at could happen. And he never did anything to not allow me to unlock my imagination and creativity. And so I really give my parents a lot of credit for being in a position to show me the best part of what humanity can offer and buying into something bigger. And so I think the transformational leadership of being a part of change and something bigger than you really started from a young age with my parents. And I'm very thankful and grateful for that.
Yeah, absolutely. And so blessed that it started so young, because we're learning a lot about how it's when you're young, that's when your brain is really impressed, your behavior is really impressed. So we're grateful for your dad, too.
Yeah, both your parents.
Both your parents,
That's right. Well, Michelle asked you about who inspires you. Now we want to know what inspires you when you come up against an obstacle or a barrier. What inspires you to just push beyond that and to create change?
Well, very often, and I talk about this a great deal with people, I have a very firm belief that the intersection of purpose and passion, when it's used for good, is probably one of the most powerful emotions that can unfold on this planet. Because when you do reach a tough moment, you dig into a different reserve internally, and you look for ways, and you look for creative ways, innovative ways, unorthodox ways, and a whole host of other adjectives I could come up with. But you really are again, trying to achieve something bigger than you, and so. Very often, one of my mottos is, people might say, hey, it's impossible. And I say, okay, yeah, it's impossible. When do we start? Can we make the impossible possible? And it doesn't mean that you're always going to win, but if you really believe that what you're trying to do is going to help people, if it will advance a cause, if it will really get to a point of transforming something for the better, then ultimately the pain doesn't matter nearly as much as the pain of losing or even not trying. And another thing I mentor people on a great deal is the things, when I look back on my life, I don't worry as much about the times I succeeded or failed. On the things that bother me the most are when I didn't try and take advantage of an opportunity to really do something good. And so that hurts more today than either if I had wildly great success or a terrible failure. So I think that's probably the most important thing, just finding the passion, connecting it to a purpose, and then pushing through until you achieve it for something bigger than you as an individual.
Mm-hmm.
Yeah. I love that.
Me too.
I kind of feel the same way, right? It's about something bigger and larger than you, and there's so much room right now for that, right? There's so much space for really focusing on what's bigger than us as individuals and what it means as a part of a whole collective. So much opportunity there. So thanks for bringing that message.
Yeah. Tracy, feel the same way about MissingLogic and what we're doing. It's like, if we don't bring this, who is going to bring it, right? And that feeling of regret if you don't follow that purpose and passion. So. Yeah, thank you, Kevin, for sharing that. We do relate to that very much so. Well, we want to congratulate you. You were recently a recipient of the R.Q. Richards Public Relations Award from the Florida Pharmacy Association for leadership in the COVID-19 pandemic. That really focused on reaching out to the communities with the goal of overcoming vaccine hesitancy. And we are just really curious about that. And if you could share with our listeners what some of your strategies were to reach out to the community.
Well, first of all, I've shared with many people. I've never done anything to go out and try and win an award. But when you do win an award, it's been unsolicited, and at least for me, it's rewarding and it feels nice. I'm glad people recognized some of the effort. Really, it started long before the pandemic when I have a program called We Care. And We Care is an acronym that stands for Workgroup Enhancing Community Advocacy and Research Engagement. And that stemmed from a NIH grant that I was a major part of several years ago, where really our role was to get out into the community, build connections and relationships so that we could educate people about clinical research with a goal of trying to increase clinical research from underrepresented communities, whether it be African American, Latino. It could be women that we need more in the community, in the clinical research study. If something was underrepresented, we wanted to be able to identify people from that community and then introduce them, educate them about what we were trying to accomplish, and hopefully provide a pathway for them to come join that clinical research. So I've been building relationships here in the Tampa Bay area and across Florida for many years now, and we had a community organization called REACHUP Incorporated that was really one of my major partners. And that was a critical relationship as the pandemic began to unfold, because we knew early on, I wanted to go out and educate the public and primarily African American communities about the forthcoming clinical trials that would happen with the vaccines. But I knew there would be a great deal of mistrust, hesitancy, and all of it well-deserved, much of it legacy for many reasons in our country.
Sure.
So I went to REACHUP, and we began building the connections that we needed to build, and we made a very coherent decision to partner with churches. That's always been a strategy that we've always tried to employ for a number of different reasons. The community is very consistent. It's very stable. As I have often said, if Miss Jones, if you can get her, she was there a year before you got there, and she will be there a year after you've been there, and then that builds an opportunity really to build clinical research opportunities. But we went to clergy, and the first thing I did was to build trust with the clergy leadership. And we began talking with them, and I began talking about the importance. And then they provided a pathway for their congregations. And then when people in the congregations heard, well, they were part of other organizations, and they liked the message we were giving. We were very honest about a lot of things. We were extremely non-judgmental. We met people where they were. Mm-hmm. And I could not have shown up in any one of the churches or nonprofit organizations or fraternities, sororities, neighborhood community groups. I could not have shown up and said, "Hey, my name is Dr. Sneed, believe me." The first thing I needed to do was build trust with their trusted members and explain to them what we were trying to accomplish. And so over a period of time, as we got the trials going, as the vaccines came out, it just continued to evolve to a point where we were able to educate a large number of people, especially in African American and Hispanic communities, about the importance of being vaccinated. And we accomplished that at a point where at one point in time we were number 2 in the state of Florida in terms of per capita, the number of people 65 and above that were being vaccinated in African American communities. Only the Jacksonville area per capita was ahead of where we were. Wow. And many people credited what we did or credited that outcome to the communication patterns that we were able to accomplish. And so I think, for anyone listening, the number one thing you have to do is build very genuine and authentic relationships with community leaders and people in communities. You have to meet them where they are. Mm-hmm. Your credentials don't mean much if they don't know first how much you care.
Mm-hmm.
Yeah, that's so important. That whole, just the genuineness, I'm sure, right, that you portrayed to them, right, your genuine interest in their well-being and establishing that, that trust and understanding of their situation, who they are, being honest. I loved what you said. We're just really honest, right? Yeah. Tell it like it is. Don't try to make it look better than what it is. Just tell it like it is, right? And I think that always goes a long way to gaining that trust. So good for you.
And over time, the other thing I heard you say, Kevin, it wasn't like a in and out type of thing. You were very intentional on building that trust over time.
Right.
And I think the outcome really showed the impact of that.
Yeah. Congratulations on that. Now, if we understand correctly, you're also working the other side of the equation and really trying to expand clinical researchers, right? And in those different diverse areas, right? For the African American and the Latinos to broaden the researcher community with those individuals as well. Tell us a little bit about that.
Yeah, so again, that takes me back to WeCare quite a bit.
Okay.
And, one thing I recognized early on, and the original NIH grant that I was a part of, at the time, we were finding about 3% immersion of African Americans into cancer research. And that was not unique to us here in the Tampa Bay area. That was just around the country. And as I began to really immerse into the real challenges, why that happened to be, it wasn't all on the side of people in the communities and their lack of wanting to be prodded on or feeling like a guinea pig or even the mistrust that was generated from the Tuskegee study or anything historic in the country. I found that many researchers and I know many of them, I've worked with them, I've been one of them. They are well-intentioned people. They wake up and they have a passion for wanting to advance science and wanting to help people. But sometimes, just for a whole host of reasons, they may not know how to communicate as effectively in some communities that they're not overly familiar with as we probably would want, or even the traditional ways of communicating. Meaning we're going to put a flyer up in the elevator. We're going to put an advertisement on a radio station that may not, that many people in African American or Latino communities may not be listening to. We're going to talk to our own patients, but many of our patients may not be coming from these communities. So the traditional ways of really finding people to participate in clinical research really did not apply. And we needed to create a pathway that now, so what we did, we created a community review committee of people directly from the community and a wide swath of the community. I mean, we had clinicians, we had teachers, we had a photographer, we had, just lay people on the committee, and we trained them. We had a training module that we took them through about clinical research. And then we had researchers come and present their research in lay terms to that review committee. And the whole idea was not for us not to vet them whether or not we were going to support them in the community or not. It was really to gain acceptance and transparency for them so that we could turn around to the community and introduce them to the researcher and then try to make their connections with their research team. And we were, we had just started down the pathway of inviting researchers to come in, and we had the research review committee, and we had everything lined up. And then February 2020 hit, and then we had to pivot. So we've had a chance to pilot, the process, and we know the process will work. Everybody's well trained and eager, but that was really how important it was to really help the researcher truly understand the community that they were coveting and wanting to bring into their clinical research.
What a great bridge.
Oh, yeah. So innovative. I really, really love that.
And do you notice a theme here with Kevin about relationships?
Yeah. No wonder you guys are kindred spirits, right?
Absolutely.
Yeah, yeah.
I tell you, if you had been there the first day, I'm not sure poor Kathy got a word in. And she was the one. She's my friend. She's the one that did the introduction. We had a wonderful. You know when you've made a very natural connection with somebody.
Sure.
Yeah.
And I think we made that natural connection that day.
Yeah.
We certainly
That's
did.
great.
We certainly did. And continue to. So, we've heard quite a bit with the COVID-19 pandemic and the impact it's had on healthcare settings, but we want to hear from you the impact it's had on academia. What do our listeners need to know of, what it's been like walking in your shoes and the challenges it's been for universities?
Well, I'm going to be completely, and I mean, I'm always honest, but
Yes,
I'm
you
going
are.
to be, I'm going to be very forthcoming and just kind of really bring in my environment. We have a very unique environment here at USF Health. We were very fortunate that we have a College of Public Health here, and our dean of our College of Public Health, actually in a former life ran a Department of Health. And so we were very fortunate that we had an individual that knew how to organize people very quickly, very efficiently, very effectively. And then we all just kind of fell into, well, what's going to be my role and what's going to be the best role and what needs to get done. And we get along very well. There are no egos among the four major deans here at USF Health. But we really we took a public health approach here at our university, and early on last year in the pandemic, because of everything that we did, the communication strategy, the mitigation strategies that we put forth, we really did have what I'm going to say not only the lowest infection rate probably in Florida, but probably the southeast of America, and we probably could even compare across all of America. We just don't have the data to support that. But the approach in terms of the challenges for academia were multiple, meaning number one, first and foremost, you make a commitment in an academic environment to create a safe environment for the student learner. And that was the number one thing that we all focused on. What can we do to try the best we can to create a safe environment for the academic learner? But then number two, we also have to create a safe environment for the faculty, the staff, and just the entire support structure of people that really hold up and hoist up the university in any academic environment. And when you think about that category of people, you have the entire health spectrum of people. People who are, the most fit people on the planet, all the way to people who are struggling with daily health challenges. And everything in between. And so, we really had to be thoughtful about how we were going to take a total health approach, a public health approach in an academic environment. And that's very difficult to understand. We pulled in our research environment, and I could not believe how quickly they engaged. One of our individuals, Dr. Tom Unash, he immediately took his own lab and helped convert the lab into a COVID testing lab. So his own research got put aside because he saw a greater need for the university, and everything that we accomplished, and we could not have done without him. So, but one thing I want to share with all of you and the listeners and the viewers, there are two components. We talk about the academic environment, and we've heard even some of the controversy around the country going on right now in terms of if a university or a school, are they going to require a mask? Are they not going to require a mask? Are they going to require vaccination or not require it? But very often, we really have to imagine that the university is just a component of the community from which people are coming onto that campus. Yeah. And so now we began to expand out into the Tampa Bay community, working with our Department of Health. There was a COVID task force for the county, for Hillsborough County, the city of Tampa. And again, Dr. Peterson, our Dean of Public Health, played a key role in communicating and helping to coordinate with the community And then our senior VP, Dr. Lockwood, early on provided much of the scientific background for many people to understand the evidence of why we were trying to accomplish what we needed. And so when I see things around the country, children at schools are going into and out of communities. Mm-hmm. Yeah. Well, if we can keep them safe in the environment, but when they leave the environment, are they going to be safe there? And if they're not, are they going to bring
it in?
The SARS-CoV-2 virus back into the environment with them?
Yeah.
And if they do, what mitigation strategy do we have at that point to try and keep the environment safe again? So there are, I've learned a great deal. There are a lot of moving parts when it comes to academia. Yeah. And ultimately, and I know, I'm fully aware that we're being recorded. Ultimately, I really believe that a vaccine strategy is imperative to try and keep everyone safe in the short and intermediate term.
Right.
Because without that, it's growing much more difficult to continue a mitigation strategy when you don't have everybody involved. And number two, when you encounter a new variant like the Delta variant that is so contagious and transmits so easily to so many people, and really scientifically can overrun the immune system in a way that we had not seen since the pandemic started.
Yeah. Yeah. Wow. There's just, it just keeps going, doesn't it? Like there's so much to learn and unpack around the whole thing, and everything is so interdependent. And I think, it just has really brought forth all the interdependencies that are a part of our lives that I think we just took for granted in so many ways for so long. And this is just really bringing out all of that, And
can I share one more thing also?
Sure.
Yeah.
Because this has really become my new platform. The thing I'm really passionate about. Because you can see I'm in my scrubs today. I still have remained clinically active even as a dean. Again, in our Department of Family Medicine, and I've had a number of patients come in and talk about the impact of what it meant for them to either themselves be infected or their family members. And the long COVID or long haulers or the post-acute viral syndrome and a whole host of other names that we have come up with are really what is driving me right now, more than ever, to try and get out and educate more people and really help them understand that we're not talking for some people, not all, but for some people we really are not talking about a short-term proposition of I got infected, I felt bad for about a week or two, and then I moved on with life. Well, many people are not moving on with life,
right?
And so and I've told my own students, I can't stomach or fathom the thought of a young person, between the age of 20 and 50, if you will, of getting infected and having, the neurological long haulers, the psychological things that I have personally witnessed from my patients, the potential for organ damage, whether it be cardiac or kidney, or, I've had patients that had lung scarring that need bilateral double lung transplants. I can't fathom the thought of any one of our young people in an academic environment having to encounter that, having to deal with that and potentially derail their dreams and their career, because we could not work harder to keep them safe. And we realize, it could happen. It could happen to almost anyone for any reason, but we don't want to get to the point that it happens because we didn't try to mitigate the circumstance of viral spread in the academic environment.
Yeah. Well, thanks for sharing that. It's so important for people to understand the realities, and I think, so many things are filtered or misunderstood, so I just really appreciate you bringing the realities and speaking those truths. I think it's just important for people to hear. We hear a lot about the front line and a lot about clinicians, physicians, nurses, that are experiencing really significant challenges and trauma from the pandemic and the experiences that they've had. What can you tell us about what pharmacists are experiencing?
Yeah, absolutely. Every segment of the healthcare team has been affected. Number one, and number two. There's a lot of mental fatigue that's occurring with all clinicians. I think pharmacists had a great deal of challenges early on because, unlike even a physician that may work in the hospital, you have to gain entry into the hospital. You have to gain entry into a medical office. But pharmacists were on the front line of having an open door of people walking into and out of the pharmacies. Still needing, needed services that didn't involve COVID-19. Still needing to get other vaccinations, needing their medications, needing advice because of things that were not COVID related. And so early on, part of the challenge I was hearing when I talked with many pharmacists was really, how am I going to protect myself? As people with COVID are very likely walking into and out of our work environment just because they have open access without the normal barriers of having to go into an emergency room or having to stop at a reception desk or whatever may have happened, temperature checking and asking questions of every individual coming into a store. So those were some of the early challenges. But I think pharmacists again are very, we are the community. We are located in the community. We have cherished that access for people to be able to come in and to walk in and access our services and our knowledge. And I think pharmacists have adjusted very quickly and immediately took up the call when it came to saying, hey, not only can we eventually provide the vaccine when you have it ready, but we can actually go in and do testing. Mm-hmm. We can do COVID testing, and we can gown up in full PPE and we can be engaged and help the community infection rates improve, identify those who are infected. And then when the vaccines came around, being really at the front line of trying to get needles in arms. Mm-hmm. And so, and then making sure that we are providing the public health knowledge back to the public, just to make sure that we're playing our role in communicating accurate information that's coming from the research community, from physician communities, from nurse and nurse practitioner communities, wherever it may come from, and being a valued resource for all of those communities to make sure that we are a part of that community network of healthcare providers. And so I think pharmacists have proven now that, number one, we're a very vital and integral part of the community. We want the access to our patients. We have learned, I think, much better how to appreciate how to provide personal protection. And then, moving forward, I think what COVID-19 and the entire pandemic has really shown is that we really do have to create more of a interprofessional network to be able to take care of entire communities of thousands of people, all the way down to, again, as I call her, that imaginary patient, Miss Jones, that's 70 years old, sitting in her house, that may not be in the best of health. And how do we meet her individual needs, but also meet the needs of tens of thousands and maybe even millions of people all at the same time?
Yeah.
Well, just from even my own personal experience, the transparency and the importance of the pharmacists through the COVID pandemic, I think it really did raise awareness from everyone in my family. And then we've had conversations with different leaders in acute care settings too, about how pharmacists have really stepped up to their full scope of practice and have been much more involved because of the necessity. But you're practicing at your full scope of practice at the same time as well. So I think it's provided a lot of opportunity.
Yeah, I agree. Yeah.
Yeah, even in the pharmacy that we run and manage here at the university, I could not have been more proud of the outreach. We knew early on a year ago that people who, for example, were diabetic or had high blood pressure, that they were at increased risk if they became infected. And so we began an outreach campaign to people who, going through a database, well, who's on a diabetes medication?
Mm-hmm.
Yeah.
And let's make sure that they have their medication in hand. We began mailing medications. We were delivering medications in vans and doing everything we could to try and help promote good health.
Sure.
In the event that they became infected, that it wouldn't spin out of control from the inflammation and the cytokine storms that really damaged so many people and continues to do it today. So, Michelle, I think you're exactly right, and in the entire healthcare team, our nurse practitioners in our practice, our physicians in our practice, our specialists in the practice, all came to depend on the fact that somebody was going to make sure when those medications got to their patients, and then we were able to hold up telehealth in record time, in probably a 2-week period. And by the way, I had been advocating for that for years.
By the way,
just as a medical futurist, I was saying, guys,
come on,
telehealth and biometric monitoring, and we can do all this stuff.
Yeah.
But we were able to put it up in a 2-week period, and then that really allowed us to have the level of outreach, and along with the medication therapy, to match up to try and keep people healthy during the pandemic.
Yep.
Yeah.
Just another silver lining in the pandemic, for sure.
Telehealth.
Well, Kevin, what gives you the greatest hope right now?
Humanity. Humanity, and let me explain exactly why I say that. It's futuristic as I try to be. I'm not the historian that my senior VP is, but I am a student of history, and what we have known about the human spirit overall is that anytime we've encountered major challenges, and whatever that challenge is, that the will to want to live eventually. Maybe not acutely, but eventually, the will to want to live and flourish typically provides a pathway out of the darkness.
Mm-hmm.
And so the level of human resilience that people have shown throughout history, I mean, if you go back and take a look at the Roman times, there were moments where they had to come through that. If you take a look at what Europeans had to go through during some of the world wars that we've had to fight, where they emerged from that. And of course, here in our country, anytime that we've had major calamities, whether it be climate-induced, war-induced, now infection and health-related, each time a group of people eventually came together and said, hey, we can do better, we can be better, and we have to come together. And so I remain hopeful that we will have the enduring human spirit that really mankind has shown throughout all of our existence of known civilization. I'll put it that way. I can't account for what happened in the Neanderthal days.
You can't.
I cannot. I've read a great book, *Sapiens*, that helped me understand probably that era a little bit better, but I cannot account for it. But what I can account for is that when societies have been challenged and stretched, that one way or the other, typically good wins out, the human spirit, resiliency wins out, and so I have to maintain that level of hope, because when people have hope, they continue to press forward, and I think hope is one of the most foremost attributes that we have as human beings that allows us to continue to move forward. And so, if nothing else, I'm going to try the best I can to maintain my hope that we as human beings will latch on to hope and pull us out of where we are today.
Yeah, yeah. I think that's a great way to put it. And
Yeah.
I mean, I just have trusted and had faith throughout the whole thing that we're going to emerge out of this better than we were before. That look at all the silver linings, just trying to keep attention on the things that have been positive, the advances that we're making. And, you just keep knowing that we're not going to have the normal we had before. It's going to be new and it's going to be different. And just trusting that over time, it's going to be exactly what we need it to be and it's going to be better, right? And just holding that faith that's the trajectory we're on.
Yeah. Well, I think the other word you mentioned, typically I say hope and faith.
Yeah.
We're going to have to maintain and hold on to both. I was meeting with a group of students not too long ago, and I said, look, at one point in time in this country, people didn't have air conditioning, but somehow they didn't realize what they were missing out on because they didn't have it. And eventually, so the standards of living that we have now really are so much further along. But the one thing that we have to maintain and I mentioned that because, you mentioned there is going to be a new normal. Mm-hmm. And because nothing stays the same as it was. That was really the point I was making to them,
Right.
Today we have air conditioning, and I even pointed out that we even have power steering in a car. I mean, I can't imagine some of my young students right now having to drive a car without power steering. I've driven a car without power steering. That was an old car, and I think I want the power steering.
That's right. I'm going for the better stuff, right? Yeah,
exactly. Yeah, exactly. So,
and none of that happens until we imagine it, until we think it's possible, to your earlier points, right?
Yeah, and that's exactly right. So, I think your point is so well taken that, there will be a new normal, and we will adapt as human beings. We will adjust as human beings, and a whole level of new innovations and transformations will emerge from what we are learning now.
Yeah. Mm-hmm.
And if we don't do that, and I am going to take one step backwards into the not so positive part, to face the reality that we have had as many people die from COVID-19 as died during the 1918 pandemic. Yep. The raw numbers now, the percentages are much different because the population was so much smaller back then. But we have so many more advances in technology now, in therapeutics and everything. So it's a little bit sobering that we do find ourselves here. But the silver lining of that comes in that we are going to learn, we will adapt, and one day I think we will be far more prepared for the next pandemic that is certain to come, I'm sure, than we are today.
Yeah. Well, it's just been such a pleasure talking with you, and now it's time for the missing questions.
Oh, okay.
Oh, yes. Don't panic. You've got it. I'm sure you've got it, right?
Okay.
This is just, we've talked a lot about the professional side of you and all your contributions. And we just kind of like our listeners to get to know you a little bit on the personal side. So we're not going to ask anything too hard, right, or too pressing. So relax. You got it.
I'm all for it.
All right. Now, little birdie told us that you're quite a sports fan. So we want to know, what is your favorite sport and who's your favorite team?
Well, without a doubt, my favorite sport is football.
Okay.
I'm a former football player. I was a high school quarterback, receiver. My college career came to an end before I had a chance to get going. So football, hands down. But to be perfectly honest, I don't necessarily have a favorite team in the way you mentioned it. Mm-hmm. Right now, my favorite team is my team, and I'm part of the USF Bulls, and and this is my team, and I know the players, I know the guys, I know the coaches, I know the vice president for athletics, I know the fans, I know the environment, and so we're in a growing phase right now, and so I'm just going to say that right now, my team here is my favorite team, and we're going to stick together through thick and thin because you know what? That's what teams do.
Absolutely.
That's right. Oh, that's awesome.
I'm watching Travis, our audio producer. He's a big football fan. As soon as you said that, his whole face lit up.
He loves football. Loves football.
But number two, right behind football, is track and field.
Oh, okay. Yeah.
Right.
All right. Track and field. Okay. All right. Now here's another toughie for you. Now, we're all about taking care of ourselves, well-being. We spend all of our time really helping leaders do that. So this is a question kind of related to that. We want to know, what's the best place you've ever been on vacation?
I would have to say, hands down, without a doubt, St. John's Island.
Oh,
okay.
Okay. That's good to know.
I've been to a lot of locations. There was just a magic that I experienced there. The ability to completely unwind and disconnect, but at the same time to enjoy myself and enjoy the water. Yeah. The snorkeling was almost out of a movie. You couldn't have scripted a movie better than the snorkeling that I experienced there, and so for me, St. John's.
All right.
Well, Tracy, I think we just got a great tip.
We got to put that on our list.
We do.
Trunk Bay, one of the best beaches in the world, and well deserved.
All right. There we go.
We ask you the missing question.
We're going to ask everybody that.
All right. Now we have a wrap-up question.
Okay.
So, one of the principles of polarities are that all of us have a preference pole. So you could take any interdependent value or pair, and all of us tend to favor one a little bit more than the other, or maybe a lot more. Just kind of depends. But I'm gonna share a polarity with you, and I just want you to tell us, what's your preference pole? Where do you lean more towards? And the polarity is individual competency or team competency.
That's not a difficult one for me at all. Team competency is going to win out. And just very quickly, I can explain why. Individual competency very often is not going to accomplish a whole lot by itself. But if you have a team concept and you build and you develop the individual competencies, now everybody's contributing to something much bigger. And so, team competency is always going to win out in that scenario. Now, in the middle of the team, you may have an outstanding person that has individual competency that is just unimaginable. I mean, you take a look at Michael Jordan, for example. Mm-hmm. That's a perfect example, I think. But no, team competency, you're going to go further. You're going to go further quicker with greater magnitude and greater impact when we all do it together. And there's zero doubt about that. It's really the core fundamental value, the core value of what civilization and society is based upon. Mm-hmm. When you really get down to it. And so absolutely team competency all the way.
All right.
Okay. Go team.
That's right. That's right.
Oh, Kevin, thank you so much. This has been absolutely a wonderful conversation with you. I'm so glad that you accepted it and that we could reconnect. I'm looking forward to reconnecting and staying connecting with you in the future. And it was just so awesome to get your frontline, experience in dealing with the pandemic as a leader, as a community member, and as an interprofessional friend and colleague. So thank you.
Yeah, and thank you for everything you're doing.
Yeah.
In the communities, in your organization, and your, I think you have such a genuine, caring spirit and, such a warmth about you. I have no doubt that everybody you've talked to just opens up and is welcoming to you. You're just such a wonderful gentleman. Thank you so much for sharing that with us.
Well, thank you all very much. And in the spirit of team, I really have to just very quickly acknowledge my team, my We Care team. I've been out front and kind of provided the vision and direction But again, I could not have accomplished anything without the team of people who have really been out there toiling right along with me. And so any recognition I've got really is on behalf of that group, and that's the honest to God truth. And I just have to mention that. So just want to make sure we acknowledge that.
You
Sure,
bet.
you
Kudos to them too.
All right.
Yeah. Yeah.
Well,
Thanks so much.
Until next time.
Yeah. Yeah.
We're closing out another episode of Healthcare's Missing Logic podcast. And stay safe, stay healthy, and we'll see you on our next episode.
Yeah. Take care, everybody.
Okay, thank you.
Thank you.
We hope you enjoyed this episode of Healthcare's Missing Logic podcast, now a top-rated podcast for healthcare leaders. Please share this podcast with other healthcare leaders and anyone else you think would benefit. We are certain that if you found value in it, they will too. If you haven't already done so, please hit that subscribe button so you don't miss any episodes. And also, it would mean the world to us if you took a quick moment to leave a rating and review on Apple Podcasts, Stitcher, or your favorite podcast player. It helps to get the word out about our podcast and incredible guests. Be sure to subscribe to our YouTube channel if you want to watch our podcasts. You can also follow us on our Missing Logic social media channels, LinkedIn, Instagram, Facebook, and Twitter. Until next time.